Hello, my name is Dr. Lori Keynes. I'm the course director for Doc A, and I will be teaching you guys about the medical history. The medical history is arguably the most important part of a medical interview. Many people say 95% of diagnoses can be made on medical history alone. Physical exam is also very important. It allows you to sort of support or refute what you were thinking was going on with the patient. But the medical history is a really important part. So these are all the components in the medical history. You can see there are a number of them. We're just going to take a crack at the first three. The objectives for part 1 are: the student will be able to perform the following components of the medical history: identifying data, chief complaint, history of present illness. The student will also be able to state the 7 parameters of a symptom. So identifying data is the first part of the medical history. It identifies the patient by age, gender, and race. It also qualifies the person as a reliable or unreliable historian, and it describes the source of the medical history. I'm going to give you 2 examples. First is the source of the medical history is a 33-year-old Hispanic male who is a reliable historian. Second example is a patient who is an 88-year-old Polish-speaking woman. She's here with her daughter who translated the medical history. She herself is a reliable historian. The chief complaint is the second part of the medical history. These are one or more symptoms or concerns for which a patient is seeking care or advice. Here are some examples of chief complaints. When you're in the beginning of your career, you might just quote the patient, and that's fine to do. You might say something like, "My feet are swollen," or "I have a rash on my hand." As you advance in your medical career, you may use more medical jargon, such as pedal edema instead of "my feet are swollen," or "skin lesions" instead of a rash. To elicit a chief complaint, you want to ask the patient an open-ended question. Some examples include: tell me what brought you to the office today, what brought you to see me today, what concerns do you have to talk to me about today, or how can I help you? You want to make sure when you're eliciting a chief complaint that you get all of the chief complaints. So if a patient, for example, comes in with chest pain, reassure them that you're going to discuss their chest pain, but then ask them if they have any other concerns they want to talk about today. If they tell you no, you can move to the history of present illness. If they say yes, you need to find out all of those concerns until you move on to the next part of the history. The history of present illness, this is probably the most important part of the medical history. It's a clear chronological narrative of the problems for which a patient is seeking care. It should include onset, the setting in which it developed, any manifestations, and any past treatments. When you're doing a history of present illness, you really need to find out the 7 parameters of a symptom. This will be a lot easier to witness when I do the demonstration, but these are the 7 parameters. It would be the location, so is it in the throat, is it in the back, the quality of the pain, and by that you want to ask the patient to describe the pain for you or describe the symptom for you. It's a qualitative measure, stabbing versus dull, for example. The quantity or severity is usually rated on a 10-point scale, 10 being the most severe, 1 being the least severe. The timing, there are a lot of questions associated with timing. You want to know, how did it start? Was it sudden or was it gradual? How long has it lasted? Is it a constant issue or is it intermittent? You want to know the setting in which it takes place. You want to know any factors that make it worse or make it better. And then you want to ask any other symptoms that might be associated with what their chief complaint was. So now I'm giving you guys a little bit of homework. I want you to watch me interview a patient. You'll see a chief complaint and you'll see a history of present illness. I want you to identify the 7 parameters of a symptom, and you'll find the answers on the following slide. Don't look at those ahead of time, but see how your answers compare with mine. I hope this video was helpful, and you know where to find me if you have any questions. Thanks very much. Hi, my name is Dr. Keynes. It's nice to meet you.
Nice to meet you.
And what would you like me to call you?
Peggy.
Peggy. Okay, it's nice to meet you, Peggy.
Nice to meet you.
What can I do to help you today?
I've had a sore throat for the last few days, and it just doesn't seem to be getting any better.
Okay. All right. So we'll definitely talk about the sore throat. Is there anything else that you want to talk about today?
No, I don't think so. Just the throat.
Just the sore throat. Okay. So why don't you tell me a little bit more about the sore throat?
Well, I've had a sore throat for about 3 or 4 days, and I'm always aware that my throat is sore. Mm-hmm. It hurts when I swallow.
Okay. All right. And did you notice that the throat started hurting all of a sudden, or was it a gradual thing?
I'm just trying to think. I noticed when I got up in the morning that my throat was sore.
Okay.
That was a few days ago. Yeah,
Okay.
so I would say I got up and it was sore.
Okay. And can you walk me through what's happened since you noticed it 3 or 4 days ago?
Well, I took some Tylenol,
Okay.
and I didn't really have any relief,
Mm-hmm.
so I just figured I better come in.
Okay. I'm glad you came in. All right. So you said, just to summarize, you've had a sore throat for the past 3 or 4 days. It came on one morning. It hurts much more to swallow. Does anything else make the throat hurt more?
No, maybe if I cough,
Okay.
but no, other than that, no.
Okay. And you mentioned that you took some Tylenol. How much did you take?
I took 2 every 4 hours.
Mm-hmm.
I would say for the last couple of days.
Okay. And it didn't provide any
No.
relief?
No, none.
Do you know the dosage of the Tylenol?
Oh, no, I really don't. No, I don't. I'm sorry.
Okay. Has anything made the sore throat better?
Nothing.
Nothing's helped so far. Okay.
Oh.
All right. And can you rate the pain on a scale of 1 to 10? 1 being very little pain and 10 being severe pain.
Probably about an 8.
8 out of 10. Oh, okay. So it's really bothersome to you.
Yeah.
Okay. All right. So we have to see what we can do to help you out. Have you had any other symptoms at all with the sore throat?
I did. I've noticed I've had a fever over
Okay.
the last couple of days.
Okay. Do you
So,
remember what the temperature was?
I think it was like 102.9.
Okay. All right. So that was a pretty significant fever. All right. Any other problems at all?
No.
Have you had any coughing?
Occasionally I will have coughing, but I don't bring anything up, but that really hurts.
Okay.
Really irritates my throat.
Okay. All right. What about any other cold symptoms at all?
No, nothing.
No runny nose?
No.
Or post-nasal dripping?
Maybe post-nasal drip,
Okay.
but that's about it. I don't know. This is really hurting.
Okay. Can you tell me a little bit more about what the pain feels like?
It started out, it was just kind of scratchy, but
Mhm.
now it's just pain, sharp pain.
Okay.
Especially if I'm swallowing, if I'm eating, which I haven't done much of, but
Right. Okay. All right. And what do you think's going on?
Gee, I don't know. I thought maybe I was coming down with a cold,
Mm-hmm.
but I don't know. I've never had a sore throat like this before.
Okay. So you're not exactly sure what it
No.
could be. Has anyone around you been sick at all?
No. Nope.
Okay. Is there anything else you think would be helpful for me to know about it?
No, just that it hurts.
Okay. All right. So we'll surely help you out with the pain. So let me just summarize to make sure I have all the details correct. You've had a sore throat for 3 or 4 days. It started out as a scratchy kind of feeling. Now it's a sharp stabbing pain that's much worse when you swallow. Nothing's really helping it, including taking some Tylenol. It's associated with a fever as high as 102.9. You're also having maybe some intermittent coughing and a little bit of postnasal drip, but no other symptoms. And you'd like to get some help with the pain because it's about an 8 out of 10. Does that
That
sum it up?
Yes.
Okay,
Mhm.
great.